Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you all of the top week 1 exercises after knee replacement surgery. Before I jump into that, hit that subscribe button, turn on the notifications to catch all of our latest videos. So these are the most common week 1 exercises, and they're probably the exercises you're going to do for the first couple of weeks as you progress through your rehab and recovery. So the first one is easy enough. You can do this in bed, you can do this seated, and it's just going to be ankle pumps. So pumping your toes, pumping your ankles, toes toward the head, toes away from the head. This is really an early exercise, help promote blood flow, help reduce your risk of a blood clot, especially early on after surgery, as you're a little bit less mobile and have a slight higher chance of a blood clot early on after surgery. The next one I'm going to show you is quad sets. Quad sets usually you're going to do laying down or with your legs out in front of you. I like to put a little towel underneath my heel or a pillow or whatever you may have, but you don't necessarily have to have that to do this exercise. Quad sets are working on strengthening early muscle contraction and strengthening of your quadriceps, of your thigh, is also working on knee extension or straightening range of motion. So you're going to be in this position, and all you're going to do is push your knee down toward the mat, down toward the bed or surface that you're on. You're going to feel your quadricep muscles tighten up and contract. Hold that for 5 seconds, working up to maybe 10 seconds at a time, and then just let it relax. Usually I'll recommend doing repetitions of 1 to 2 sets of 10 repetitions of these. Again, holding each time for at least 5 seconds and working your way up to holding for 10 seconds at a time. Another one we can do up here on the bed or lying flat are heel slides. If you have a stretching strap, if you have a long bed sheet that you can roll up or a towel, you can use it, but again, you don't necessarily need that to perform this exercise. Heel slides, you're going to start with your leg out straight, keeping your heel down on the surface. You're just going to slide it toward your bottom as your knee bends. Get to that sticking point. Usually I recommend holding that for a few seconds if you can, trying to push into it, and then slowly let it relax. I always share there's kind of 2 options with this. You can do some nice, quick, smooth repetitions, just getting that knee moving, bending and straightening. Or you can really get to that end range of motion and try to hold that stretch, hold that position for 5 seconds, 10 seconds, and then let it relax. With that stretching strap or towel, it's going to look exactly the same. Just now when you get up at the top of your range of motion, you can give that extra little pull, try to get a little bit more bend, a little bit more flexion. Again, trying to hold it for 5 seconds, 10 seconds, and then just let it relax. Usually I'll recommend, again, about 10 to 15 repetitions. With range of motion exercises, we're not too worried about how many repetitions and sets. It actually tends to be a little bit more is better, as long as you're not getting a sharp exacerbation of your pain and symptoms. So maybe doing a few sets 2 or 3 times a day is a good thing in that first week after surgery. But of course, listen to the specific recommendations of your doctor, of your physical therapist and healthcare team. Another exercise here is a great range of motion and stretching exercise. You're going to bring your leg up and actually hug underneath your thigh, hug around your hamstrings, so your leg and your hip is up in this flexed position. And you're just going to try to straighten the knee as much as you possibly can and let it bend as much as you can as well. Just going slow and controlled. Usually do about 10 or 15 times going up, 10 or 15 times going down. This one takes a little bit of strength, especially if you're having some pain, stiffness, swelling early on. It might be a little more challenging, and that's okay. That's not unexpected, but really a good exercise to stretch out the leg muscles and also working on your range of motion early on after surgery. We also want to do a couple exercises that are going to focus on strengthening not just your quadriceps, but also strengthening for your hips and your glutes, as this is going to be very important for your mobility and your function after surgery. So from the table or your bed, we can do bridges. So knees bent up. Early on after surgery, if you have to keep your legs out a little bit, that's okay, that's to be expected. But all you're going to do is just lift your hips and pelvis up toward the ceiling and then let them come back down. Everything's slow and controlled. Usually do about 2 or 3 sets of 10 repetitions. If you're getting some back pain with this, you can focus on doing a posterior pelvic tilt. So trying to push your low back flat, tuck your belly button in. You should feel your pelvis kind of tilt toward your head and holding that position. That will help get the activation from your glutes less than from your low back. Again, this might be challenging early on after surgery, but a good beginning strengthening exercise. Another one we like to do is supine hip abduction. So basically you have your legs out straight in front of you on the bed or wherever you are. And I tell people to do a windshield wiper. So you're going to slide your leg out to the side as far as you can and then slide it back in toward the middle. And you're just going to go in and out, 10 or 15 repetitions, sliding that leg in and out. Another good strengthening exercise for your hips are clamshells. So a lot of times I'll start people out with clamshells lying on their back or in supine. So you're lying on your back, have the legs bent up, try to get your legs close together, touching if you can. And usually I'll have a band, a TheraBand wrapped around the legs. And you're just going to pull your knees apart, little past hip width, and slow and controlled bring them back together. Now this is a little bit easier than if you're lying on your side. So if you can tolerate it, it is good to do the clamshells lying on your side. Again, you can also put that TheraBand around your legs to give a little more resistance. Keeping your feet together. Hips are bent about 45-degree angle, bend of your hips and your knees. And you're just lifting that top knee up and down. Do 2 sets of 10 repetitions, switch and do the other side. Always important to strengthen and work on both sides. Alright, so then there are a couple of the exercises lying down that you would do in bed or on your couch, and now we'll transition and show you some of the ones that you would do in a seated position. Alright, and then here are some week 1 exercises that you would perform from a seated position. So sitting up on the edge of your seat, one is seated knee extensions. So just nice and easy, trying to straighten your knee all the way up. You can hold that for a second or two and let it come back down. Eventually you can add some ankle weights to this, but I wouldn't recommend doing that until you have that full knee extension. You're able to achieve full knee extension or straightening from this position. So those are seated knee extensions. You can also do seated heel slides or foot slides. So starting with your foot out in front of you a little bit. Doesn't have to be perfectly straight. You're just going to slide your foot and heel back. Your heel can come off if you're really doing well and can bend this far back. Probably early on you'll get to about this point and you can use your other leg to give an extra little push. Hold that end range for maybe 5 or 10 seconds. And then just let it come back out. And you can actually use your opposite leg to help push it back out too, by kind of wrapping it behind. So sliding the heel back as far as you can, giving an extra little push with your opposite leg, and then just let it relax back out. So those are seated heel slides or foot slides, really good for knee flexion, early knee flexion, knee bending range of motion exercises. Also from the chair, we're going to do some sit to stands. Again, focusing on strengthening through the legs, your quadriceps as well as your glutes and your hips. If you can, trying to do it with your arms crossed and not using your hands to push up. But if you do need to early on, you can use your hands to give a little assistance. You're just going to hinge forward Push up to a fully standing position, and then slow and controlled come back down. A really important part that people neglect is that downward part. We don't want to plop down or flop down, which I'm sure you may have heard from your therapist. We want to go strong up and then slow and controlled as we come back down. This is for safety, as also you're working your muscles and your coordination as well with doing it in that slow and controlled manner. So that's sit to stands. One other exercise here. You may or may not start this week 1 from surgery, but doing some step-ups. Definitely recommend holding on to a rail with one or both hands early on after surgery for stability. You're going to go up with the good and down with the bad. So you're going to lead with your non-surgical foot, come up, and then if you have a staircase, go up the staircase, and then going down, you're going to lead with the bad. So you're going to lead with your surgical leg first, and then bring your non-surgical leg. Now if you're doing stairs for training, you can lead with the good and lead with the bad. You can do step-ups leading with the bad if you're doing it for the purposes of strengthening. But just doing the stairs, up with the good, down with the bad, or up with the non-surgical, down with the surgical first. And then the other exercise that really good first week after surgery is walking. Getting up, walking, short walks, short bouts, multiple times throughout the day, even if it's just walking through your home, walking to go to the bathroom, getting your body up and moving. Really important, arguably the most important thing that first week after surgery. So I hope you found this video helpful and insightful. Please be sure to hit that like button if you did. Please be sure to leave your comments and questions. Again, hit that subscribe button and turn on the notification to catch all of our latest videos. Thank you for watching.